This is a medical news broadcast to make you aware of recent developments. It is important to understand that this is not medical advice. Hello and welcome to the Medical Justice News Brief. Thank you for joining us today as we bring your attention to a recently published breakthrough for the treatment of pain. SRP-001 is an experimental first-in-class non-opioid analgesic drug that is being developed by South Rampart Pharma to treat acute pain. It works by activating pain signaling pathways in the midbrain's periaqueductal gray region without causing liver or kidney toxicities. The periaqueductal gray matter, also called PAG, is a critical brain structure located here around the aqueduct of Sylvius in the midbrain. It plays a significant role in the modulation and control of pain perception and the body's response to pain. Here are some key points about how the periaqueductal gray matter affects pain. The PAG is involved in both the perception and modulation of pain. It contains a complex network of neurons and is interconnected with various brain regions involved in pain processing, including the thalamus, amygdala, and cerebral cortex. Stimulation of certain areas within the PAG can produce analgesia, which is the reduction or suppression of pain perception. This analgesic effect occurs through the release of endogenous opioids, such as enkephalins and endorphins, which act on opioid receptors in the brain and spinal cord to inhibit pain transmission. This is similar to endorphin release in the nucleus accumbens, but in the PAG, there should be no euphoria produced, since the nucleus accumbens is the reward center of the brain, while the PAG is the alertness center. And since euphoria is critical to the development of addiction, PAG-mediated pain relief might not trigger this terrible condition. Pain can be relieved in the periaqueductal gray through descending pathways that inhibit the transmission of pain signals in the spinal cord's dorsal horn. This inhibitory effect is one of the mechanisms by which the brain can control the intensity of pain perception, turning it off during fight or flight responses. It also plays a role in the modulation of autonomic functions, including heart rate and blood pressure, in response to pain or stress. Stimulation of specific regions in the PAG can also elicit defensive behaviors, such as freezing or vocalizations in response to acute pain or threats. The PAG is part of the descending pain modulatory system, which includes the rostral ventral medial medulla and other brainstem structures. Together, these structures form a circuit that regulates pain perception by sending signals to the spinal cord to enhance or inhibit pain transmission as it tries to make its way up to the cortex and conscious awareness. The PAG is also implicated in the placebo effect, where a person experiences pain relief due to the belief that they are receiving an effective treatment. Placebo-induced pain relief is associated with changes in PAG activity. The PAG's role in pain modulation can vary significantly between individuals. Some people may have more effective pain modulating systems than others, which can influence their pain tolerance and sensitivity. Drugs that target the periaqueductal gray matter, like SRP-001, can be used to treat pain by modulating these pain perception pathways in the brain. How are drugs that target the PAG different from current medications for pain management? Tylenol, a very common medication, is responsible for more cases of liver failure than any other cause. Opioid drugs, such as morphine, codeine, and oxycodone, primarily exert their analgesic effects by binding to opioid receptors in the brain, spinal cord, and other pain-related areas, including the PAG. These drugs are effective for moderate to severe pain management, but carry a risk of addiction because they also activate receptors in the nucleus accumbens. Other medications, like NSAIDs, work by inhibiting prostaglandins, but they have their own complications, such as an increased risk of heart attack and stroke, bleeding disorders, and ulcers. And then there are medications like the cannabinoids, tetrahydrocannabinol and cannabidiol, which also impact the PAG. The endocannabinoid system interacts with the PAG to regulate pain perception and inflammation. Studies show that some cannabinoid-based treatments could be very effective for pain conditions, including neuropathic pain and chronic pain syndrome. SRP-001 is a small molecule drug that can cross the blood-brain barrier and enter the PAG. Once in the PAG, SRP-001 binds to a protein called the cannabinoid receptor 1, or CB1R. The CB1R is a G-protein-coupled receptor that is involved in a variety of signaling pathways, including pain modulation. Once bound to the CB1R, it activates a signaling pathway that leads to the release of endorphins in the PAG. SRP-001 also inhibits the release of glutamate, a neurotransmitter that plays a role in pain signaling, and glutamate overexcitation can lead to central sensitization, which is a condition in which the nervous system becomes more sensitive to pain. SRP-001 is thought to reduce central sensitization by reducing the release of glutamate. In the future, other medications might also be used to stimulate GABAergic inhibitory neurons in the PAG, which would then suppress PAG activity, reducing pain sensitivity. Many other common medications affect the PAG also. Certain antidepressant medications, such as duloxetine and venlafaxine, are SNRIs that increase serotonin and noradrenaline levels in the brain. They can indirectly impact the PAG and other brain regions involved in pain modulation, some in the spinal cord, sometimes in a few people, providing some relief from chronic pain conditions. It also might be possible to use non-pharmaceutical techniques, like transcranial magnetic stimulation or transcranial direct current stimulation, which can target specific brain areas, including the PAG, to alleviate pain. It's important to note that the PAG is very deep in the brain, and these would be difficult to administer to an ambulatory patient, but might be accessible to deep brain stimulation. It's also important to note that the use of drugs targeting the PAG for pain management should be carefully considered and prescribed by qualified healthcare professionals. Individual responses to these medications may vary, and potential side effects and risks should be weighed against the benefits. Additionally, a comprehensive approach to pain management will include a combination of pharmacological interventions, physical therapies, and psychological treatments, as well as newer modalities, like transcranial magnetic stimulation and neurofeedback, to address the multifaceted nature of chronic pain. In summary, the periaqueductal gray region is a crucial brain region involved in pain modulation and control. It exerts its effects through complex neural networks and is affected by the release of endogenous opioids and interactions with other brain structures. Understanding the PAG's role in pain processing is essential for developing strategies to manage and treat chronic pain conditions. SRP-001 has shown promise in preclinical studies demonstrating efficacy in several pain models, including the inflammatory von Frey, visceral, and somatic pain models. In a Phase 1 clinical trial, SRP-001 was found to be safe and well tolerated, and it showed robust pharmacokinetics. South Rampart Pharma is currently conducting a Phase 2 clinical trial of SRP-001 in patients with acute pain. The trial is expected to be completed in 2024. If successful, SRP-001 could provide a new and safer alternative to opioids for the treatment of acute and possibly chronic pain. SRP has the potential to offer several advantages over traditional pain medications such as opioids and non-steroidal anti-inflammatory drugs. While opioids are highly effective at relieving pain, they can also cause serious side effects, such as addiction, overdose, and death. Through the PAG region's endocannabinoid, mechanical nociception, and fatty acid amide hydrolase pathways. Unlike the opioids, SRP-001 doesn't carry a risk of abuse and addiction, as far as we know. Unlike Tylenol, SRP-001 lacks the hepatotoxicity associated with that medication, and it does not produce the harmful metabolite NAPQ1, which causes harm to hepatocytes and can disrupt liver cell tight junctions. Compared with acetaminophen, SRP-001 exhibits similar analgesic properties without the risk of liver damage, and it also lacks NSAID's kidney toxicity risk. SRP-001 is designed to be non-addictive and to have fewer side effects than opioids and NSAIDs, and it is possible that SRP-001 may be more effective than traditional pain medications for certain types of pain, especially inflammatory pain. The development of SRP-001 is an exciting advance in the field of pain management. If successful, this could provide a new and safer way to treat pain through the endocannabinoid system's effect on the periaqueductal gray matter. If you found this video informative, please like and share it, and don't forget to subscribe for more thought-provoking content. A link to the study can be found in the description. Just a side note, while the federal government still denies any medical benefit to cannabis, it is only too happy to approve novel and certainly expensive new drugs that work through the same endocannabinoid system. Something to think about. Thank you for listening, and let us continue to strive for a healthcare approach grounded in the latest research and guided by empathy and individual understanding. Until next time, take care and stay informed.